Okay, my name is Dennis Somba. I come from Shomoroni. I'm a graduate from Moi University, and I'm a content creator, but that's just a side name. I'm an agronomist by profession. I've done agribusiness management. So what I do now is content creation. I have a podcast called the Off Script Duo, where I create awareness. I talk to people about the things that are less talked about. Yeah, so that's what for now I'm doing.
And what was your life before your eyesight began to deteriorate? And what did a typical day look like for you?
Okay, life was normal, just like any other Kenyan, any other person. It was beautiful, enjoyable before any complication. And I was enjoying life like a normal person who was no complication. A typical day was like any other day in Kenya or in the world.
When did you first notice something was wrong with your eye?
Okay, growing up, I never knew I was short-sighted until I was in high school, where now I started developing complication in seeing the blackboard until I had to sit in the front seat. In Form 4, my eyes started developing problems. I had to seek for spectacles. Then I ran with spectacles until I think last year, when I had to change my spectacles. Then is when it was around July, where after getting the new specs, a light started flashing in my eye, in my left eye, from one end to the other end. So I went back to the optical shop where I had received the specs from. I talked to them. They told me nothing was wrong with my eyes. So I went back again. They said nothing is wrong. Until now, it was about, was it this year or? Yeah, it was this year when I went back January. And I told them that my eye has developed. It's now, I can see completely. It's halfway blind. The upper side is seeing, the lower side is not seeing. They checked me, they told me nothing is wrong, so they had to refer me to another hospital, now an eye hospital, where I met Victor and he guided me through the process.
How did they affect your studies and daily life?
Yeah, it was complicated since, okay, it was scary, it was stressful.
I would prefer, like you say, in life, so that you just don't go for the answer, because if you can't it might not make it. So how did they affect your studies and daily life? So after.
Okay, how it affected my life is that I was used to seeing things normal. I had adapted to using glasses, and now I'm used to seeing with both eyes, and one is not seeing clearly. So it got scary to me, and I was a bit tensed. So the doctors are saying I'm okay, but deep down I feel I'm not okay. So I was feeling a bit so scared. So when I went for the checkup, I noticed that, oh, something is wrong with me, and that actually terrified me, saying that I'm going to go blind, because that is what doctor told me. If it's not taken to immediate surgery, I'm going to go blind, and it will be permanent. So it was scary, and I tensed. So after then, I was told it can be treated and it can be rectified. So at least that brought hope alive.
Can you walk us through the surgery experience? What was it like before, during, and after?
Okay. Surgery life was, okay, I can say it's scary for everyone. It's something just because you don't know what will happen there. You don't know whether the chances are 50-50. I know the doctors are so convincing and they'll tell you it is going to be a success. But there are cases where surgery has not been a success. It has failed, so I was confused. But I met with good doctors. Oh, they worked with me, they counseled me, and before then, that morning I woke up, it was like, but I convinced myself, my friends and families were there, then they told me it's possible. I had to walk to the theater. It was something out of the normal.
What was the moment like when you realized that your sight had been restored?
Okay. Yeah, sorry for that. After surgery, the surgery took me 1 hour. Haijani ilikuwa distracted sana.
Okay.
Yeah, tunaweza rudia.
Take another one.
Tunaweza rudia that part, yeah.
Can you walk us through the surgery experience? Yeah. What it was like before, during, and after, and try to make your
short.
Yes.
Yeah. Okay. Yeah, the surgery life was. It was scary. It was something that I've never experienced before. So, but through the comfort of my family and friends, I had the courage to go to the theater. So, I went. It took me about 1 hour, 30 minutes, and I was done. Then after there, I was told I'm going to be okay, but I was still bandaged, so I didn't know what it's going to be like. But after now the bandage, I started regaining my sight slowly by slowly, which took around 2 weeks so that I could start seeing again clearly.
What was the moment like when you realized your sight had been restored?
Okay, it was jovial. It was an happy moment for me. I was so excited that now I can see again. Now I can start seeing normally. The problem that I was experiencing is now over. So I was happy.
How has your life changed since the surgery, personally and professionally?
Okay, it has been good since now I was threatened. Now I'm out of danger, and I'm excited. I can work, I can perform like any other person. I can perform like a normal person, so I don't have to strain about anything. My eyes are completely okay.
Are there any routines or habits you have adapted to protect your eyes health now?
Yeah, they are like now I have to do regular checkups, which I go. I never knew like eyes are so essential that I have to go for checkup, but now I do regular checkups for my eyes. And also I've reduced the screen time. I've also adapted lenses that can prevent me from the screen light.
What does World Sight Day mean to you now?
Okay, World Sight Day, it's an important day that reminds us how we have taken eyes for granted. And it's about creating awareness and educating people about the importance of eyes and how eyes are essential to us.
What message would you share with the young people who might be ignoring early signs of vision problems?
Okay, I will tell them the early the better. So, okay, anyone who is out there and is experiencing eye problem and has been ignoring them, I'll tell you the earlier the better. So go get checked up, let the problem be diagnosed, and you'll be treated to save your eyes.
Looking back, what gave you strength during the toughest moment?
Okay, it was family and friends who stuck by me all through and encouraged me throughout the process.
What are you most excited about now that your vision is restored?
I'm excited about life, that I can see nature well, I can explore, I can walk comfortably, and I can perform to my potential.
were to sum up your journey in one word or phrase, what would you be like?
I'll say this is a second chance that I've been given, and I'm so proud of it.
I wish you could have, like, instead of just answering me the question, you start, yeah. You make it like, because for someone who will get that phrase, it don't make sense. You get
Okay.
nitarudia pia na Kiswahili. But the way it was answering is, so we'll just start it fresh. We are giving you a new chance to redeem yourself. Can you tell us a bit about yourself, where you are from, and what you do?
Okay, my name is Dennis Somba. I'm a graduate from Moi University, and I come from Shomoroni in Mombasa. Yeah, currently, I'm a content creator. I run a YouTube channel called the Off Script Duo, where I share about life, things that are challenging but are less spoken about. We try to unfilter life and approach life as it is.
What was your life before your eyesight began to deteriorate, and what did a typical day look like for you?
Okay, my life was a bit okay. Pardon me.
Oh, don't worry about it. What was your life before your eyesight began to deteriorate, and what did a typical day look like for you?
Okay, my life was good. I was waking up like any other normal Kenyan. I was living like a normal person without any difficulties. And a normal day to me, it was like a normal day to any other person who has got both eyes well, operating well.
What did you first notice something was wrong with your, when did you first notice something was wrong with your eyesight?
Yeah, okay, I grew up knowing that I have no problem with eyes, but in high school I noticed that I was a short-sighted person. So in Form 4 I started experiencing problems. I had to sit closer to the board. I was prescribed to specs. So after there, my life came back to normal until last year when I had to change now the specs, where I started experiencing lights flashing from one side of the eye to the other side of the eye on my left eye. So I went back to the optical shop and they told me there was nothing wrong with me. I insisted, and on my that day they referred me to an hospital where I went. I saw an optometry, and he helped me to be diagnosed, and my problem was finally discovered.
How did you feel when you learned the condition was serious but treatable?
Okay. At first, for any other person, when you have been living normally and now you have something has come up, you also experience a bit of tension. You are scared about what is happening with me. So it wasn't something that I took it so lightly, and it was a bit stressing. But when it was diagnosed and I was told you have a retina detachment and it can be corrected, that brought hope alive in me.
Can you walk us through the surgery experience? What was it like before, during, and after? And avoid the word okay.
Yeah, surgery experience was a bit scary for me because it was the first time I was to go to the theater. I've never been there before. I've never taken someone to theater. So I went to the hospital. I was cancelled. I walked there with friends. Then I had to get to the theater alone, which took about 1 hour, 30 minutes. And after that, I came out with a... After the surgery, after the 1 hour, 30 minutes, I came out of the surgery with a bandage. I didn't realize that I have received my eyes back. So I was a bit, what's happening? Until the bandage was taken off and I started regaining my sight, which took around 2 weeks that I could start seeing again clearly.
What was the moment like when you realized your sight had been restored?
Okay, it was jovial. I was so excited that now I can see again. The danger that was there has now been taken off my way, and I can continue with my life as I used to.
How has life changed since surgery, personal and professional?
Okay, life has been good since surgery. I've been living a normal life. I've been attending to checkups. I've never experienced the complication again. So I took on my duties. I work as a normal person. I work as a normal person. No complication, and I'm okay.
Are there any routines or habits you have adapted to protect your eye now?
Yeah, I have developed some routines that I have to adhere to. That is going for checkups or preventing myself from staying long hours in the screen. I also got prescribed to lenses that can protect me from the screen light, and that is something that I never thought that is possible, but now it's possible, and my eyes are healthy.
What does World Sight Day mean to you now?
Okay, World Sight Day to me is a day where we tend to create awareness and inform people of the things that have been taken for granted, and to tell them that it's important to take care of their eyes. Eyes are essential to their daily life. So everyone has to be careful with their eyes.
What message would you share with the young people who might be ignoring early signs of vision problems?
To any young person out there who has been experiencing problems but is reluctant or ignoring them, I would tell him or her that this is the high time you get checked up, because the earlier the better you get checked up, your problem be diagnosed before it becomes a severe one.
Looking back, what gave you strength during the toughest moments?
One thing that kept me going in that difficult moment was family and friends who stuck with me, who encouraged me, who motivated me, and told me it is possible. So without them, I couldn't have gone through it, and I don't know whether it could have been possible.
What are you most excited about now that your vision is restored?
Yeah, I'm excited about life, that I can explore life normally. I can face life without any complication. I can see clearly, and like any other person, I don't have any complication that I can say I'm straining my eyes or my eyes are limiting me to do this. I can explore my full potential now.
If you could sum up your journey in one word or phrase, what would it be like?
I'd say this is as to sum up the whole thing, all the journey. I'll say it is a second chance that life has given me. Yeah. Yeah, the journey, my journey was challenging. So I got diagnosed, and the moment that I knew that something was wrong with me, I had to stop some things. So like my regular routine was disrupted. The things that I would wake up every day, every morning to do, I would no longer do. So now I had to get checked up, and also every day you have to wake up to follow up with the hospital, what is happening. So now it's like everything has stopped and you are focusing on the problem that you are having now, because it is like it has taken a whole shift of your entire life now. So I had to wake up, to go to the hospital, to follow up, also raising the resources, because umembua leo you have to take the surgery is going to take like 250,000, and it's money that you don't have, and you have been given 1 week. So that 1 week was up and down, up and down. I would be looking for, also I was told that we don't have doctors in Mombasa. I had to go to Nairobi. So also traveling is also disrupting my schedule, putting my work to a standstill so that now I can face now the reality that I'm experiencing. And also after surgery, it wasn't like life the way it was, because now there's the recovery period. Also, the doctor also advised me that immediately after surgery, I had to wear the other kinds of glasses. They look like those of the welding glasses. So they were covering my whole eyes, the dark ones during the day and colorless ones during the night. So it was to protect my eyes from dust, from the surrounding. And also the sitting posture had to change. I was sitting facing downwards. There's a term that they were calling it. And also I couldn't use my phone or the way I used to. Some things I had to put aside so that I can focus with healing. It took me a while, almost 6 months, to completely recover so that I can say now I can get back to my normal life. Yeah.
Cool.
Okay.
Tell us who are you?
Oh, right. I'm Victor Opiyo, the president of Optometry Association of Kenya, and also the Secretary General of the African Council of Optometry. I'm so passionate about eye care policy and legislation, and I've been in this position for the last 6 years, initially serving as the organizing secretary.
Can you walk us through what was happening in Dennis' eyes and why retinal detachment can be so dangerous if left untreated?
One of the common denominator about retinal detachment is normally it is an ocular emergency. So early detection and the speed to the doctor is something that is very crucial. So to come to Dennis' part, Dennis was born short-sighted. Short-sighted means he was unable to see things at a distance. And that normally comes in because initially we used just to correct myopia but not manage, unlike nowadays where we are managing myopia. So when you're myopic as a patient or when you are short-sighted, most of the time the eyeball keeps on growing. So Dennis' eye kept on growing, and that is why his prescription kept on changing. He goes to an outlet X or an hospital Y, then you find the prescription is changing. That one was an indication that the eye is growing. So the more the eye grows, the more that one creates pressure at the back of the eye, that is the retina. Retina is like a film. So the more pressure is built up on the retina, it starts thinning and it can pull away from its wall. And that is how Dennis' issue came about. So he had walked through many outlets and they were unable to diagnose such condition.
I think you have answered what made his case particularly urgent and unusual.
Yeah.
How common is it for young people to experience retinal issue like this, and what are the warning signs?
So basically from experience, retinal detachment is not something that is very common to the young adults. It is very common to the elderly. So his case was unique, and the reason why the case was unique is because he was myopic and it was being controlled, it was not being managed. So that is why we say that since it was unique, it was very urgent to deal with it. And if I can recall also, repeat that question again.
There was what made this case particularly urgent and unusual?
Yeah, that one you answered.
How common is it for young men to experience retinal issue like this, and what are the warning signs?
Oh, fine, okay. So retinal detachment is not a common thing to the young ones or the young adults. It is very common to the elderly. So some of the warning signs that are normally there when you have retinal detachment is flashes. You'll see flashes, shadows in your vision, and floaters. those are the key warning signs that you observe when you have retinal detachment.
What was the surgical process like, and what factors contributed to its success?
Any surgical process is normally unique, and it needs a lot of motivation. So before even getting to the surgery, we normally do a lot of investigations to confirm that everything is in place and the eye is in a good state. So the journey, the surgery journey was a success, putting in mind the compliance from Dennis himself, and the kind of instrumentation that we have and the professionals that we have in our setup made it a success story for us as an entity.
I expected, sorry, because I've gone through the same, I expected you to say that kind of moving immediately noticed and moved very fast.
Yeah. Mm.
So you can,
but so you want me to paraphrase it?
yes,
then I put an emergency.
It was urgent for him to the first step, the earlier he took, because I know somebody who he has lost because he spent 3 years before. So
Repeat the question.
Let me repeat the question. What was the surgical process like, and what factors contribute to its success?
Okay, fine. So the surgical process was a success, being that we noticed the issue at an early stage, and again, Dennis as a patient also was serious, and after explanation and doing investigation about his condition, he took it as a medical emergency. So we planned the surgery as soon as possible, and he complied. So that is why it was a success story. And even that, after the surgery, there is normally that healing period. He was so religious during that healing period.
What are the most common causes of vision loss among young adults in Kenya?
The most common vision loss nowadays that the world is struggling with in young adults is refractive errors. Refractive error is an inability to see at distance or at near, and also we have such cases of trauma. Trauma is an injury from an object. We have also trying to, as a nation, we are also struggling with the burden of these people who have systemic conditions. Systemic conditions are like hypertension, diabetes, and etc. So those kind of conditions predispose you to some of the some of the eye conditions that can be reversed if we notice them early.
How do symptoms like flashing lights and eye strain signal deeper problems?
Yeah, flashes of light and any other related symptom normally calls for an emergency, because most of the time it can be a neurological condition or a retinal condition. And remember, I say that retina is like the film of your camera. So if the film is out, it means that vision might be gone if something is not done as soon as possible.
What is the difference between an optometrist and an ophthalmologist? And when should someone seek specialist care?
An optometrist is a professional who is trained properly and regulated, and optometrists are trained from diploma to degree level, and they are normally primary eye care workers that you can find at primary, secondary, and tertiary level depending on someone's training. So what an optometry does is, most of the time we do eye examination. We can manage some types of ocular conditions depending on our scope. Optometry is also, we do a bit in terms of glasses, prescribing contact lenses, low vision aids, and optometry does rehabilitation a lot. Even at some level we do research, and optometrists can even be a teacher somewhere. So what differentiates us from ophthalmologists? Ophthalmologists are medical doctors, and as from Kenyan's perspective, you have to undergo the medical course, then another 4 years thorough training in surgical. So the difference between an optometrist and an ophthalmologist comes in terms of level of training and our scope. So the scope, the level of an ophthalmologist is at tertiary level, whereby they also do they do almost all the surgeries, and they take almost 8 years in school. So the referral pathway normally is defined. Since an optometrist is someone who is at primary level, so referral pathways are there either horizontally or vertically. And most of the time, cases like of Dennis, the retinal cases, are some of the cases that we refer for management by an ophthalmologist.
When should someone seek specialist care?
Specialist care is something that is called for anyone. It doesn't matter any time. So anytime, I normally tell most of my patients that the best thing as Africans is we need to always listen to our body. Anytime you feel that something is not correct, your body is not working, you have woken up, your vision is blurry, you have woken up, you are seeing floaters, that one calls for an urgent attention. So listen to your body, and if you are not feeling that the body is not serving you well, that is the right time to see any specialist, not only about the eyes.
How much of vision loss we see in Kenya is preventable in early intervention?
So that one, there is a lot of burden when it comes to eye care, and there is a large population of individuals who are suffering from avoidable blindness. And you see, in our country, we have a very big population. That is around 56 million. And healthcare professionals, the number is very low. Like for optometrists, we are around 640, and ophthalmologists are under 200. So it is very, very crucial that redo it.
Okay. How much of the vision loss we
Okay,
see
fine, I got it.
And is it preventable? Is it preventable with
So,
early intervention?
okay, so I want you to keep, okay. Globally, we are struggling with the burden when it comes to loss of vision. So like half of the cases are normally avoidable. And that is what we borrow from, putting in mind that as a nation we are serving a big population, and around 24% of all Kenyans need eye care. So a half of 24% of people who need eye care, most of them carry the burden of irreversible or avoidable blindness. So that is around 40 to 50% who need such kind of services.
What are the biggest barriers to timely diagnosis, especially in underserved communities?
So in underserved communities, and when we speak about underserved communities, we are speaking about the peri-urban and rural areas. So some of the major barriers that we have, number one, is in terms of access. Number two, there is cost. Seeking medical attention is very expensive. Remember, when you are going to the hospital, you have to use a vehicle. When you are going to the hospital, you have to pay for consultation. After consultation, maybe there is medication, there is a surgery. Those guys are I'm very sensitive.
Okay.
Yeah?
So,
But now,
but what we need to take a picture. Regular eye exams play in preventing blindness, and how often should people get checked?
so routine eye examination is recommended for anyone, and most of the time we recommend that all matters constant. If you don't have any symptom, you are supposed to do an annual eye test. And for kids, for the young ones, before going to school as a preschooler, you are supposed to do a comprehensive eye test. But for people with systemic conditions, diabetes, hypertension, arthritis, we recommend regular eye test. That is, even after 6 months, you need to see your doctor. But the concept that we should not lose is you always have to listen to your body. If things are not working properly, you make sure you see the doctor as soon as possible.
Are there enough trained eye care professionals in Kenya to meet the current demand?
The demand when it comes to eye care is very, very low. We are really struggling with human resources. Take an example, the ophthalmologists who are the specialists at tertiary level, we are only having under 200 ophthalmologists. And optometrists, who are supposed to be at the lower part of the lower tiers of the hospital, are only around 640 something, thereabout. So you see the burden is huge. So the ratio of patient to doctor is still huge. And again, we are also struggling with the access in terms of most of these doctors are centered in town or urban areas. So areas outside the urban areas are really struggling with access because of reduction, because of low numbers of human resources in eye health.
What can be done to improve referral system between optometrists and ophthalmologists?
Actually, referral system for any cadre doesn't have to only to be about an optometrist and an ophthalmologist. Referral pathways have to be there in all cadres. For say, if you come today with hypertension, as an optometrist, I'll see you, then I refer you to a clinician. But for our concept for a referral pathway from an optometrist to an ophthalmologist, because most of the time we are tax shifting, there should be a clear pathway on how referrals are done. And also, we should have a collaborative approach on how we relate with each other. Remember, a referral has to be a two-way journey. I refer you to Dr. X. Dr. X will do an examination and also is supposed to give me a feedback. That one will also help me to develop as a profession. And also we can integrate our referral pathways. Nowadays we are embracing electronics. So if referral pathways can be done electronically, you find we can ease this access.
How can schools, universities, and workplaces better support eye awareness?
So most of the time the schools, if you look at the schools carry the young population, and the young population can be used as a media of creating advocacy and awareness. In terms of, we can use them when we are doing our screenings, we can visit them at the schools, they can carry for us the message that eye care is something that has got a meaning, and it is very, very relevant to always do regular eye tests.
What does World Sight Day mean to you as a practitioner?
Yeah, excellent. World Sight Day normally is a day that as eye care practitioners, we make noise about our services. We are trying to create awareness. We are trying to advocate about what we do, and it is also a point whereby we try to talk to people, the political wing, that there is a lot that can be done in eye care if we invest in eye care. So in totality, World Sight Day is a day created to create more awareness about our services and how we can influence the policy makers to do one or two about our eye section.
What message would you share with the public about protecting their vision?
So for the public, it is paramount. Most of the time, there are a lot of things that we ignore. In terms of wearing sunglasses, eating properly, in terms of regular eye tests. So to the general public, what I can say is listen to your body. Anytime things are not going well, do a bit of protective gears. Let's reduce screen time for the young ones, because those are some of the harmful things that we ignore most of the time.
What policy or investment would make the biggest difference in reducing preventable blindness in Kenya?
So there are a lot of policies that can be done, and number one, the reason why we talk about policies are related to barriers. There are barriers that may make one person not to get medical attention or proper eye care. So some of the policies that we have been doing across is influencing proper regulation in eye care. Also, we have tried to come up with a scope of practice, what determines what you and me can do and the boundaries. There is also, remember we are discussing about low number of human personnel in eye care. So we're also trying to have a conversation, to trigger conversation that we need to train more optometrists. And as much as we train more optometrists, we have to make sure that we create for them an establishment in most of our county hospitals, because there is where there is level 3, level 4, level 5 in that order. So if we can influence, if you can make noise towards these policy programs, at least we will create access and availability of our of eye care services in the country.
Maybe how much does it cost to do eye surgery?
So most of the time, we have different types of eye surgeries. Eye surgeries cut across because we have glaucoma surgery, we have cataract surgery, we have surgery that can be done after trauma. So the cost is a bit high. That one I can't lie, because we invest a lot when it comes to investigations that are done prior to the surgeries, and even the surgical equipments. And put in mind, the professionals are also not there. So the cost is high depending on the surgery type. But also, if you look at what is happening now when it comes to cataract, the government is we are trying to have a conversation with the government, so that since there is a big burden when it comes to cataract surgery, so you find the value of cataract surgery is not as that one of retinal detachment. But in totality, most of them, the cost is a bit high.
Like this retinal detachment, how much does it cost?
Roughly, I can't give a figure, but retinal detachment in public, what I know in public setup could be a bit, the cost could be a bit low, but in private part, I know it is a bit high. Yeah, roughly around, in most of the public setups, around 250,000 per eye.
That's what I paid at Umma's hospital. That was one. It's a process. And maybe the cases that can be treated, how many are there in our population?
Most of the eye care problems, as we had indicated, is that like a half of them normally are avoidable, or irreversible. You can reverse them. So there are a lot of eye problems, over 100. So I can't speak I can't speak to all of them. But what I know is something can always be done if detection is done earlier and there is a prompt, and if there is a prompt in seeking attention.
So, in order to talk about
pale kwa optometry, can we redo the difference between an yeah. So I was saying an optometrist is a professional eye care who has been trained and properly regulated. So optometrists are found at different levels, at primary, secondary, and tertiary level, depending on the training. And most of the time, optometrists, we conduct comprehensive eye examination. We can dispense glasses, contact lenses, low vision aids. We can also do a bit of rehabilitation and referral, and also we co-shift with ophthalmologists in managing patients after surgery. Also, optometrists at tertiary level are doing research, teaching, and etc. When it comes to an ophthalmologist, our Kenyan's perspective is this has to be a medical doctor. Then after the medical school, you go and advance and specialize in surgery and more of comprehensive ophthalmology. So normally, most of the ophthalmologists are found at tertiary level, and they deal with the most of hard cases like surgical cases in eye care. Haya, kwa majina mimi naitwa Victor Opiyo. Mimi ndio kiongozi wa madaktari wote wa macho au ni optometrist. Mimi pia ni kiongozi kule wa Afrika mzima kama katibu mkuu, na nimekaa kwa uongozi kwa muda wa karibu miaka 6. Napenda sana uongozi na pia napenda kuona wagonjwa wangu kila mara. Yeah, it's okay. I'll just.
Can you walk us through what's happening with Dennis' eyes and the retinal detachment? Can it be so dangerous if left untreated?
Yeah, Dennis alikuwa na shida ya kutoona mbali kutoka utotoni, na shida ya kutoona ni inaletwa na kama kuna tofauti na ile size ya eyeball ya mtu. So wakati mwingi kule kitambo tulikuwa tuna correct kutoona mbali na miwani, lakini hatukuwa tunazingatia ile kukua kwa macho. So hii ndio ilisababisha Dennis kuweza kukua na retinal detachment. Na retinal detachment ni kama film ya kamera. Kule ndani ya macho kuna ile part inaitwa retina. So ile part ikijiondoa kwenye kule nyuma, unapata kunakuwa na upungufu wa kuona. Mtu anaanza kuona flashes ama unaanza kuona shadows.
What made this case particularly urgent and unusual?
The reason why wakati mwingi unajua retina ni kiungo kikubwa cha macho ambayo iko na layers karibu 10. So hii retina huwa inataka ile urgent attention. So mtu asipopelekwa kwa ile urgency, unapata matokeo mara mingi huwa si mazuri. So Dennis alikuja hospitali kwa wakati ambao unafaa, akafanyiwa investigations, na pia yeye kama mgonjwa alikuwa mtiifu, na baada ya siku 2-3 akaenda akafanyiwa operation, na ndio maana kwa leo Dennis anaweza ona vizuri.
How common is it for young men to experience a retinal issue like this, and what are the warning signs? Kiswahili.
Retinal detachment si kitu ambayo ni very common kwa watu wenye umri mdogo. Wakati mwingi retinal detachment iko very common kwa watu wenye ambao wamekomaa. Na retinal detachment huwa inataka ili matokeo yawe mazuri, inataka matibabu ya haraka.
What was the surgical process like, and what factors contribute to its success?
Operation ya Dennis iliendelea vizuri, na kile ambacho tunasema kile ambacho ilisaidia hii operation ikuwe na success ni vile ye mwenyewe alijitokeza kama mgonjwa na pia akakubali kutembea na sisi. Alafu pia kwa saa hii Kenya tumeendelea in terms of investigations zenye ambazo tunafanya. Kuna zile investigations ambazo huwa tunafanya kuangalia kule retina, tunajua ni upande upi wa retina, ni upande wa juu au wa chini ndio inajitokeza ama ni upande upi. So ukiunganisha hayo na wale madaktari ambao tuko nao wenye utaaluma wa juu, inafanya matokeo ya operationi kama hizi zinakuwa na success ya hali ya juu.
What are the most common causes of vision loss among young adults in Kenya?
Katika nchi yetu ya Kenya, wakati mwingi tuko na ile burden kubwa ya watu kutokuwa na shida ya kuona mbali na karibu. Na pia kuna ule wakati kwa watu wachanga wanapenda kuja hospitalini kama macho imegongwa na vitu kama hayo. Na pia kuna yale magonjwa ambayo unaweza pata kwa watu wa umri mdogo wenye ugonjwa wa kisukari ama pressure, yenye pia ikiingia kwenye jicho inaweza kula macho polepole na ifanye macho kuweza kupotea. Na pia kuna zile infection na ile allergy za macho. Kila mara mtoto ajikuna macho, vitu kama hayo. Hayo yanaweza sababisha upungufu wa kuona, na pia yasipotibiwa kwa muda ambao unafaa yanaweza fanya mtu apoteze jicho.
How do symptoms like flashing lights and eye strain signal deeper problem?
Floaters, how do you call floaters in Swahili?
You can just describe vile zinakuwa.
Okay. Symptom.
Just how do symptoms like flashing lights and eye strain, hizo signs zinaashiriaje kwamba kuna shida kubwa inakuja?
Zile signs za macho kama kuona vitu kama floaters, kuona vitu kama shadows kwa field yako ya vision, na kusikia maumivu ama ile kustrain kwa jicho, yanaweza kuwa alarming signs kwa mambo ya neurological, ama kunaweza kuwa na shida kule nyuma ya macho. So ukiona signs and symptoms kama hayo, unahitajika kuona yule daktari wa macho kwa haraka zaidi, ili kama kutakuwa na shida, treatment ianzishwe na matokeo ya matibabu yawe mazuri.
Tunafika pale tofauti ya optometrist na optometrist. Itakuwa hiyo turuke?
It's okay, I can try.
Go ahead.
So optometrist ni yule tabibu ambaye anapatikana kwa ule upande wa chini. Ni yule mtu wa kwanza ambaye wewe kama mgonjwa wa macho unafaa kukutana naye. Lakini ophthalmologist ni ule mtu mwenye akona taaluma ya hali ya juu, ambaye pia amepewa ile authority ya kufanya surgery, na wanapatikana at the tertiary level. But hawa wote kulingana na penye utakutana na yeye na kulingana na masomo ya mtu, wote wanaweza patikana at primary, secondary ama upande wa juu wa tertiary.
When should someone seek specialist care?
Mimi wakati mwingi huwa naambia watu, ukiamka asubuhi, sikiza mwili wako. Kama mwili wako haukupeleki vizuri, cause mwili ndio kiumbo ambayo kama mwili wako ikupeleki vizuri, unafaa kuona daktari. Usingojee ukae na symptoms kwa muda mrefu ndio uende kuona daktari. Wakati wowote ambao unahisi kuna kiungo fulani kwenye mwili ambayo haifanyi kazi vizuri, unahitajika kuona mtaalamu yeyote.
How much of the vision loss we see in Kenya is preventable in early intervention?
Nusu ya Wakenya ambao wako na shida ya macho wako na zile shida za macho ambayo zaweza tibika. Nusu ya hao watu.
What are the biggest barriers to timely diagnosis, especially in underserved communities?
So kile ambacho kama eye care tuna shida nayo ni kuna nambari ya chini ya madaktari wa macho. Kuna ile pia cost ya seek medical attention, na pia kuna yale mambo mengine ambayo yanasababisha tuko na hizi facility, lakini unapata kule kwa facility hakuna specialist. Na pia ile am I repeating myself, gharama na cost is one thing, eh? We can redo it.
Okay. Go ahead. It's recording.
Oh, it's recording. Okay. Kama inchi kile ambacho inaweza hebu reread the question.
What are the biggest barriers to timely diagnosis, especially underserved communities?
So zile barriers ambayo zinafanya watu example mtu kule ndani Turkana anakosa kupata matibabu ya macho, inaweza kuwa ni the low number of our madaktari wa macho. Kuna ile gharama ya huduma, kuna pia ile kutojua. Kuna wale wako na shida ya macho lakini hajui ako na shida ya macho. So ile kutojua inafanya watu wengi wasifike kwa daktari kwa muda ambao ufaao. Alafu cha mwisho pia ni kunao madaktari wa macho, yes, lakini bado serikali bado haijawatambua vizuri na kuhakikisha kwamba imewaingiza kwenye primary eye health.
What role do regular eye exam play in preventing blindness? How often should people get checked?
So kila mara na huwa anasema kama wewe ni mtu mzima na huna shida yote ya kimwili, huna ugonjwa wote wa kimwili, macho inafaa kuangaliwa kila mwaka. Lakini kwa watoto, before mtoto aanze shule, anafaa kupelekwa kwa daktari wa macho aangalie macho kama inaona vizuri. Lakini kama uko na ugonjwa wote wa kimwili kama kisukari, pressure, hakikisha kwamba unaona daktari wa macho baada ya miezi 6 au routinely kulingana na vile yule daktari wako atakuelezea.
Are there enough eye care professionals in Kenya to meet the current demand?
Tukizingatia nambari ya wahudumu wa macho katika nchi yetu ya Kenya, nambari iko chini.
Go ahead.
Tukiangalia nambari ya wahudumu wa macho kwenye nchi yetu ya Kenya, nambari bado iko chini. Sasa unapata wakati mwingi wagonjwa hawana ile how will I put it in Swahili?
Try to be very brief.
Aya, rudia tena.
Are there enough trained eye care professionals in Kenya?
No. Yeah. Madaktari wa macho ni wachache kwenye nchi yetu, na pia ukilinganisha hiyo na wagonjwa ambao wanahitaji matibabu ya macho.
What can be done to improve referral system between optometrists and ophthalmists?
Kile ambacho inaweza fanywa ili kuhakikisha kwamba mgonjwa anaona daktari mwenye ujuzi wa juu ni kuhakikisha sisi wote kwenye hii eye health tunafanya kazi pamoja, na pia tunaweza weka referral pathways kwa system. Kama siku hizi tuna embrace electronics, hiyo inaweza rahisisha the referral.
How can schools, universities and workplace better support eye health awareness? Shule kuu zinaweza saidia ku create awareness kwa watu, kwa sababu hao ni watu ambao wanataalamika. So wakati tunaenda kwao tunawafanyia screening, wanaweza elezea wenzao. Ni kama media, tunaweza watumia kama media ya kufanya advocacy. What does World Sight Day mean as a practitioner?
So World Sight Day kwa kwetu kama madaktari wa macho mimi huelezea watu wengi ni kile ambacho tunafaa kuwa tuna celebrate kila siku. Hatufai kungojea tu ni mpaka ikue tarehe 9 ama second Thursday of every October. So ni ile wakati tunafaa kupiga kelele, tuongee na serikali ili ijue kwamba kuna return kwa investment kama watawekeza kwenye eye care. Na pia ni wakati ambao tunajaribu kuinfluence policy makers wajue kwamba kuna uwezekano mkubwa kama utapiga support mzuri kwa madaktari wa macho. Na pia kwa ile basket yetu kutoka kule juu ni wakati wa kuambia serikali ongeza kile ambacho wewe unatupatia kwa high health, tupate pesa mzuri yenye inaweza tu support kama eye section.
What message would you share with public about protecting their vision?
Kile ambacho naelezea watu kwa jumla ni macho ndio kiungo ambayo inakusaidia kuona nje. Na macho ndio kiungo ambacho mara ya kwanza inakusaidia kuleta ule upendo. Kumbuka ukizaa mtoto, mara ya kwanza mtoto huwa anatengeneza upendo na mama yake. So macho ni kiungo kimoja cha mwili ambacho ni muhimu. So zingatia wakati wote unahisi vibaya kwenye jicho, ona daktari wa macho. Na pia kuna zile preventive care zenye unafaa kufanya. Kama uenda kwa jua, vaa sunglasses. Kama watoto wetu nowadays wanakaa sana kwa simu, tunafaa kupunguza mambo kama hayo.
What policy or investment would you make the biggest difference in reducing preventable blindness in Kenya?
So kile changamoto ambayo tuko nayo katika eye health kwa nchi yetu, number 1 ni kutokuwa na proper regulation. Kama tunaweza kuwa na proper regulation and also tuhakikishe kwamba hao madaktari wote wa macho wanapatikana kwa kila county, inaweza rahisisha mtu kupata yale matibabu ya wataalamu.